silver lining with the fact that the pace of vaccinations as well is picking up?
Well, there are several silver linings. First of all, this is a larger wave, no doubt about it, but that was a shorter wave, probably because of lockdown effect. So, this is a real sense we are having that this is what it is going to be. And let me tell you and assure you that for a year or two, we have to learn to live with this. It is going to go away in a coming time, but it is going to take time. As far as vaccination is concerned, it's a great thing which has happened, and government has taken new steps to start more than 100,000 vaccinations per day. But we will need to reach to at least more than 1 million or 2 in a day in order to have a herd immunity in the coming time. With such a wave coming in, we are going to get a herd immunity. All hospitals are presently full, but it is going to go down now. Anytime now, and by 15th of May, it will be at a low level. What I personally feel is within a 2 to 3 months' time, another peak might come and we should be prepared for it. That is how I feel about the whole thing.
Okay. Dr. Vikram, good morning. Nikunj Dalme also joining in. So nice to connect with you. We're connecting with you when times are really difficult. Normally, we ask you a question about your company financials and shareholder-dominated questions. Today, we are taking the liberty to ask about COVID. Now, when you say that you expect the infection to peak out, which means according to your analysis, in and around May, middle or May end, you think the second wave should peak out. I don't want to get this one wrong, sir. That's why I'm asking you again.
Yeah, good morning, Nikunj. The thing is that, slowly, we are peaking out at this point of time. So, last time also it happened that, a typical curve, if you draw, it goes down from here anytime from this week. And then it will go down further because of the herd immunity.
Okay. Now, what happens to the normal operations of Shalby Hospital during this time? When the first wave had hit us, everybody who wanted to go for non-critical surgeries, they decided to delay that. You are a specialist in hip and knee replacement. That is not a critical surgery or a critical operation. Will the business suffer because of the second wave?
Well, to be very honest with you, actually we are going through nearly 2 to 3 times occupancy now. So, we are having huge occupancy of our ICCUs, no beds available across the hospitals. Across the hospital, occupancy is nearly 100%. And as far as the revenues are concerned, they are more than double. We don't like this kind of revenue, but it is like that. Having said this, about cold surgeries, March we did all-time high surgeries. So, they come back. Once things cool down, they come back for all kind of cold surgeries like, cardiac surgeries or joint replacement surgeries, spine surgeries. So, the moment it will go, and presently also we are operating. Actually, we are doing at least 3-4 surgeries a day, which is actually 10% of what volume we usually handle. But, as soon as it goes down, patients who are suffering, they just come back and get their problems sorted out.
What about the COVID revenue? I'm again just referring to COVID not as a business, but a pure line of operation for a listed company like yours. What are the margins on the COVID business? How much revenue is that?
COVID revenue ARPOB is much less than what surgical revenue ARPOB we usually get. But as the occupancy level are at 2.5 times and number of our hospitals are at all-time high, actually they are full. We don't have beds. So, we end up with nearly 3 times turnover than a typical month or a typical quarter.
Are there any restrictions for hospitals when it comes to the charge on COVID revenue or other, the other revenue items, are they capped by the governments?
Yeah, they are kept by government, but they are reasonably good. We are able to still get our margins back.
Dr. Shah, this is also the time when a lot of hospitals have come forward, and hospital like yours, you have voluntarily increased beds. You have given some of their main wards to and directed them towards COVID care. Can you walk us through that at Shalby and the operations what you have in Maharashtra and Gujarat and other parts of India, your dominant sectors? How many new beds you managed to create because of the second wave?
Because of second wave, we have added nearly 200 beds. So, we are working at nearly 40 to 1500 beds. The situation in Gujarat and Madhya Pradesh is bad, so those hospitals are full. As far as Rajasthan and Mohali is concerned, those hospitals are not full because it is not as bad as Gujarat or Madhya Pradesh or Maharashtra there.
If the situation on ground worsens, what do you think it means for the hospital sector per se? Do you see there could be a chance where, in order to protect and save our, save people, hospitals could be asked to increase more COVID beds, and that in a sense could hurt revenues in the short term?
No, actually, this is not hurting revenue. If you see, as such, when you have a COVID wave, cold work reduces and this work increases, so it is fine, as far as hospital is concerned, hospitals should function and hospitals should be able to serve the population in one way or the other way.
Dr. Vikram, large part of your revenue, which is your core specialization, the knee replacement and the hip replacement, was also dependent on medical tourism. Your brand is a strong brand, and I am aware of the fact that a lot of NRIs and lot of business comes via medical tourism. Now there are restrictions on travel. So irrespective of what happens on COVID, do you think your medical tourism business, which is an important business for you, could be subdued?
Well, it is subdued. If you ask about medical tourists coming to India, it's at 10% than what it was. But having said this, most of our hospitals are full with COVID patients. So we have only one hospital remaining, which is non-COVID, where we can admit them. So, all hospitals are full. There is no place I can put these patients. So even if they come, we cannot treat them.
So what should shareholders look forward to? FY21 was difficult, FY21 too early to call. When do you think normalization will happen? And because of the business drop which has happened in your core business, how are you planning to cut corners? How will you make a comeback?
No, see, we have come back. If you see our last 2 quarters, we have done great. This last quarter will also be doing good. And this month is going to be several times more than... as far as financial results are concerned, we will be doing much better than what we used to do. So that's not an issue. Issue is about our core specialty. So that's a cold work. That is not going to go away anywhere. Once the COVID, starts coming down, that work will increase. As I said earlier, that in March, February and March, both we did the highest number of replacements in our entire history of 25 years.
Final question, Dr. Vikram, which is, every sector when it goes through a crisis normally sees a consolidation. The big get bigger and the strong get stronger. You are a strong brand, a specialized hospital with a very large niche focus and a great global brand. How will you benefit because of the consolidation which is happening and which will happen in your sector?
Well, large number of nursing homes are now getting closed down because of stricter and stringent government rules and Nursing Home Clinical Establishment Act. So, we are entering into a franchisee kind of model where we do not want to invest a lot of money. We will be going into an existing infrastructure rather than buying in. And we will be giving our orthopedic specialty treatment in this franchisee, whereby it will increase our top and bottom line without investment. So long-term plan is to increase our ROC and bring it to double digit as fast as possible.
Well, Dr. Vikram, really appreciate your time, and thank you once again for joining us, and thank you once again for the relentless service your doctors, your organization is currently doing to keep us all safe and protected. Appreciate your time, sir, and thank you very much. All right, let's take a break now. Markets slightly puffy.